Okay, so welcome to our information session on the Integrated Behavioral Healthcare Training Program, which we call the IBHC training program. These are the three kind of core team. So I am the project director, Shelley's the field director, and then Krista Bobek is our program coordinator. And so a lot of communication comes from Krista, who is not here today, but you will definitely hear from her. We're going to talk a little bit about the background of this training program, which I mentioned is in its second year. We'll describe the different components of the training program. So if you're an IBHC scholar, what kind of specialized training and experiences would you get? We'll talk about eligibility, the application process, and some tips and tricks we have developed or to share with you about the application. And then we'll have time for question and answer. So we established this training program when we received a grant through the Behavioral Health Workforce Education and Training program. This is a grant from HRSA, which is a federal agency. We are not the only school that gets this. We have a region, and there are about 20 or so schools in our region who have a similar training program. One of the big draws for us in applying for this grant is that it provides $10,000 stipends to at least 29 MSW students each year who are planning to do their clinical field placements in the academic year. And we call our students IBHC scholars. So it's almost it's over $1 million in stipends that we're able to offer students over the course of this 4-year grant, 4 different cohorts. So the goal that we've established for our program is to prepare professionally trained and licensed MSW level social workers to serve underserved communities in high need, high demand, integrated care settings in Minnesota and beyond. We also place students in Wisconsin and surrounding states using trauma-informed, culturally and linguistically responsive, evidence-based approaches. So to unpack that term a little bit more, what is integrated behavioral health care? Integrated care is a team-based approach to providing whole person care. So these are settings where at least 2 health professions work together in a team to meet holistically the needs of patients or clients. So for example, that would be a social worker and at least one other health profession. And we define health profession really broadly. So it could be sort of the traditional health professions like physicians and nurses, psychologists or other mental health providers. Substance use counselors are really important components of IBHC teams, occupational therapy, physical therapy, as well as community health workers, home visitors, or spiritual healers, or other types of healthcare providers. So people who are working with social workers to meet holistically the behavioral health needs of people. Why is integrated behavioral healthcare important? Why is this a growing and increasingly emphasized practice area? It responds to some specific challenges in our current healthcare system structure. In our current system, and anyone who's worked in healthcare or utilized healthcare services can attest to this, our systems are very siloed. And so you go here for one need, you go here for another need, you go here for another need. And every single one of those places has their own access barriers. And it puts a lot of pressure on the person seeking service to navigate all of these different access barriers and try to coordinate their own care. We also have a lack of culturally relevant services that are even available. And all of these things contribute to broad health inequities and result in many communities being medically underserved. And people with limited English proficiency face some of the biggest barriers to accessing the care that they need. And the result, as I said, is that there are many groups that are underrepresented, that are medically underserved. And among these groups, there is also a lack of representation in the behavioral health workforce. So we know that our current behavioral health workforce does not reflect the populations that are seeking care, and that can create access barriers as well. And we see a lot of opportunities in this growing practice area. Currently, social workers make up the largest group of mental health care providers in the US. There are more social workers providing mental health care than any other discipline. Integrating behavioral health services, again, like team-based care, working together to coordinate services and respond to whole health needs. We know that they increase access to behavioral health care and that they improve health across the lifespan. So we know that this is a model that works. And social workers who are trained in person and environment theory and person-centered care and are committed to social justice on all system levels, we play really important roles in integrated behavioral health care teams when working with medically underserved communities. So to give you an example of what integrated behavioral health care looks like for someone who's seeking care. So just in this example, imagine a person has severe anxiety and they lose their job, leading to financial concerns. They also have pre-existing health conditions that they are not able to pay to treat, and they don't know where to look for resources to help. The client might begin using substances to cope with their anxiety, which might exacerbate pre-existing health conditions. So what do? They go to a place that they know where they can get help. They go to a community-based agency, and that agency connects them or helps them access care at an integrated behavioral health care clinic. So once they go to this integrated behavioral health care clinic, the nurse practitioner can address the pre-existing health conditions. They can take that client's hand and walk them down the hall to see a clinical social worker about their anxiety. Maybe there's also a substance use counselor, or maybe the social work has that expertise who can address the substance use. And then that team can also connect them to resources to alleviate the financial strain through employment supports. So rather than the client having to go here, there, and there to access these services, they can come to a clinic that has an integrated behavioral health care team who will coordinate their care and who will work together through a team-based model to meet their needs holistically. The objectives of our program are to increase competencies in trauma-informed, culturally and linguistically responsive, integrated behavioral healthcare with medically underserved communities. So in a nutshell, that is the goal of our program. We also seek to improve the demographic representation of the behavioral health care workforce. So we encourage social work students who are from historically excluded or underrepresented communities to apply for this grant program. And then the long-term and overall goal is that we hope to increase access to quality integrated behavioral health care for medically underserved communities. So I'm going to pass it over to Shelley to talk about the components of the training program.
Thank you, Tonya. All right, so we have basically three umbrellas under which all of our training falls. The first is the experiential training, and that's your clinical field placement. And we're going to break down each of these components a little more specifically. The second one is the classroom learning that kind of mirrors and supplements and really enhances what you're doing in your clinical field placement. And then the third component is the employment and licensure support. So that are the things that we want to do to not only support you through the program, but up until graduation, and then ideally employment in serving medically underserved communities. So when we look at the next slide, when we look at experiential, there's three parts to that experiential training. The first is that clinical field placement in an IBHC approved site. We have also an IBHC speaker series. That is a really exciting opportunity where we bring in integrated teams from the community to meet with the IBHC scholars 5 times a year and talk about like the specific work that they are doing in the field and how that social worker and the other healthcare provider team and give real life examples. Those happen on Zoom, and at the first year and the second year, the timing of those, because of the busyness of people's schedules, really ended up to be Friday, like around 4:30 to 6 o'clock. So 5 Friday evenings throughout the year, we had the speaker series. And then the final thing in the experiential is a simulation. And Ruben participated in a half-day simulation learning lab where you were kind of collaborating and consulting and doing a kind of a practice of a real life scenario and how that team comes together to really embrace that whole person care. We may not have that half day this year, but we also work with, as Tonya mentioned earlier, we are part of Region 5 in the country of awardees of this grant, and we've developed a relationship with our specific region, and specifically 5 or 6 of the universities in this region are coming together in the spring to do a simulation where we'll have the first kind of presentation will be didactic, and it looks like we're leaning towards youth and trauma-informed care. And then students will have an opportunity to break out into breakout sessions. Again, this will be via Zoom because this will have students from across the Midwest, nursing students, occupational therapy students, social work students, psychology students, working together doing this simulation. And that's going to happen in April of this year. And so we're really excited about that opportunity. The second component is coursework. Specifically, we have an integrated behavioral health care class. It's called GRSW 629. If you're looking at your screen, I'm actually addressing the middle component here, clinical practice and integrated behavioral health care. And it is that class that really supplements kind of the textbook learning to what's kind of currently going on in the field of integrated care. And so that is a required elective course. Your field seminar, a lot of you are in foundation placement right now, so you realize that you have the foundation placement and a concurrent field seminar. So for IBHC scholars, the field seminar is focused with just scholars in the seminar. So we award 29 scholars, and there are 3 field seminars. And so you would participate in one of those 3 IBHC field seminars. And then we offer an online training in the ethics of telemental health. And so some of you will have opportunity to provide both in-person care and telehealth care in your clinical field placement, but we want to assure that all of you at least have that initial training in telehealth. And then the final umbrella that I mentioned earlier are those licensure and career supports. So we're going to work with you on licensure prep, post-graduation employment, and opening kind of the dialogue around loan forgiveness program. Some of the loan forgiveness programs you need to wait until you're licensed at the independent level, and then you can begin a loan repayment. So we want to stay with you and really make you aware of the resources. So in addition to the $10,000 stipend, individuals who serve medically underserved communities in their profession and career often are eligible for loan forgiveness. And so we'll work with you to make sure you have exposure and knowledge about those programs. And then lots of other additional resources and training. I mentioned the Region 5 of those grant awardees, those 26 universities that have this grant across the Midwest. This year, we're offering lunch and learns, and they're free, and they're like an hour over lunch, and they address all the components of the training program: trauma-informed care, culturally responsive care, work with youth, focus on youth violence prevention, and substance abuse. And really embedded in all of that is that culturally responsive care. So those are kind of the main components. You've got your field placement and your field seminar, your elective course, and then we're going to be really doing our best to support you to licensure at that LGSW level, but then also trying to stay with you to support your career development and knowledge around loan forgiveness. So in looking at the curriculum, again, everything is going to be embedded in these three components. So you'll see a common thread: interprofessional, team-based integrated care, trauma-informed, culturally responsive. And then we're going to also add content on substance abuse and chemical dependency, often one of those speaker series. We just had a speaker from Alliance come in for our speaker series and talk about the stigma in communities that are historically excluded, or immigrant and refugee communities where there is that stigma. And so how do you create even an awareness of the need, but then a treatment and a program to address the need? And so we really try to also supplement your learning around substance abuse, intimate partner violence, and youth violence prevention, clinical practice with children, adolescents, and transition-aged youth. Now, it is a component of the grant, so you also may have an interest in aging, or your field placement may focus more on the older population. It's okay, because you're going to get curriculum and you're going to get exposure to this kind of component of the grant, which does focus on children, adolescent, and transition-aged youth. And then, of course, as I mentioned, the ethics of telemental health. That is a module-based learning. It is non-credit bearing, and there's no cost to you. And you have, over the course of the year, to complete that module-based component of the training program. So a lot of questions often around what's an IBHC field placement site. So when we're looking at your clinical field placement options, we're really looking for some key components. One, it needs to utilize a team-based approach. So that means a social worker and at least one other health professional. It needs to occur in a high-need, high-demand setting. And that's defined by the federal government as a health shortage area. So either a mental health shortage area, or a primary care shortage area, or a rural community. And as part of this training program, we select and hold aside 3 to 5 HRSA scholarships for rural community focus. And so rural communities or high need, high demand areas in the urban setting. And we find that by the zip code of the agency that you're interested in serving for your clinical field placement. But you're not on your own determining that. So I will work very closely with you. Basically, we produce the opportunities listing book for most of the urban settings by late March. You'll review that book, and anything that is of interest to you, you're going to email me the address, kind of your interest, and then I determine if it's a qualifying site, and then I respond and I say, yep, this is a qualifying site, and then you can proceed to apply. For those of you in rural settings, you're going to use a process which we call the self-initiated process, meaning you're just going to consult with me about agencies in the area that you might be interested in. Most rural communities, we don't have to worry about it qualifying, because in the state of Minnesota, most of the areas outside of the metro, beyond the suburban corridor, do qualify as rural sites. So you and I will work very closely together to determine, even before you apply, that it's a qualifying site. All right, Tonya.
Okay. So I am going to talk a little bit about the stipend component of the training program and then some reporting requirements. So stipends are $10,000 per student, and that money is to offset living expenses. So it's not a scholarship, it's not a tuition reduction. It is a check that's mailed in the fall and in the spring, so two $5,000 checks. If you want or you choose to use that for tuition, we try to make sure those checks are sent out before the tuition deadline so that you can if you want to, but it is intended to offset living expenses and increase access to graduate education. And then the last point we have here is that because it is a federally funded, a federal grant that funds the tuitions and this program, or excuse me, the stipends and this program, there are data collection and reporting requirements. So we do require you to complete a pre-test and a post-test. And that's general information about knowledge and competencies around integrated care, some demographic questions, and then we do need to send out surveys 1 year post-graduation. So we ask for your non-St. Thomas email, and we do reach out a year after you graduate to follow up. And that's for HRSA, who's collecting data on percentage of people who are employed and the types of settings that folks are working in. So it's not totally onerous, but it is a few extra things you have to do. So now I'm going to talk about who is eligible to apply and when you're eligible to apply for this training program. You can be a full-time student, you can be a part-time student, you can be a hybrid student. Current students are required to be in good academic standing per the student handbook. This is a training program that you participate in during the academic year that you're doing your clinical field placement. It is not possible to do this training program with a summer block field placement. It has to be, you have to do your clinical field placement during the academic year to qualify for this program. And these are all federal requirements that we don't have, we did not create. So interest in working with medically underserved populations in a high need, high demand setting after graduation. As I mentioned, a goal of this program is to increase access to care for medically underserved populations. It's not we don't require you to pay back the money if you don't work in a specific setting after graduation. There is no, that doesn't exist. Sometimes that exists for child welfare scholarships or special education programs. But for this program, it is a hope that we have that, and it's one of the things we ask about in the application process, since that is the goal of this program. Per federal guidelines, you have to be eligible to work in the US and must be a citizen, national, or permanent resident. Again, we didn't set that rule, but we have to follow it. And then students from groups historically excluded, currently underrepresented in the healthcare workforce, or are encouraged to apply. And HRSA has sort of a broad definition of underrepresentation, which could be groups from different racial, ethnic, cultural, geographic, religious, linguistic, and class backgrounds, and different genders and sexual orientations. So on the application, we ask you to self-identify if you consider yourself from one of these groups. And we do save at least 3 spots for students, as Shelley said, who are interested in working in rural settings. So either you plan to do your field placement in a rural setting, you plan to work in a rural setting. We save a few spots for students interested in that practice area. So the application, what does the application process look like? Applications for the 2023-24, so this is next fall, are due February 9th, and they're due at midnight, and we don't accept any applications after midnight. So we recommend that you submit it early. Don't wait till the last minute in case you have any technical issues, because we, again, don't accept anything that comes in after midnight. It's an online application. Here is a link to the application. If you saw, I assume you're here because you saw an email with a flyer about info sessions that also had the link. But if for some reason you aren't able to find this link, you can just reach out to me or Krista, and we will send out these slides after probably Monday morning. So you can access the link there too. The application itself is not a very long application. It's really directed to the things that we need to know about you and that you need to know about the program. So we didn't want the application to be a barrier to people applying for this program. So there are a few demographic questions, and then actually there's 3 narrative questions that require narrative answers and one that requires a 1-sentence answer. And then we ask you to upload a resume. So the narrative questions are, please explain why you are interested in participating in the IBHC training program. Describe your experience and or interest in serving medically underserved communities. This could include your lived experience, your volunteer experience, and or professional experience. And include in your response how you demonstrate cultural humility in your social work practice. And then the 3rd narrative question is to describe your future professional goals to practice in an integrated behavioral healthcare setting and with medically underserved communities, being as specific as possible about the type of setting you're interested in working in and the populations you're interested in working with. So we don't expect you to have a crystal ball and know at this point exactly where you want to work post-graduation. We just want an idea of what your professional goals related to these 2 areas are. And then the last one, which I said is not really a narrative question, we list all the components of the training program that Shelley talked about a couple slides ago, and we just ask you to read through them and then indicate that you're willing to participate in all of the components of the training program. So you can just write 1 sentence that says, I understand and I'm willing to participate in all parts of the training program. A couple tips that we would like to share with you. We do recommend that it's a Qualtrics survey that the application is built in. And we do recommend that you write your answers to the narrative questions in like a Word or other type of word processing document, and then copy and paste them into the online application when you're ready to submit, to avoid timing out or any possibility of losing your work. Your application will automatically save what you've entered, and if you come back to it from the same browser and the same device. So if you are using Google Chrome on your laptop at home, and you come back and you open your laptop and you go to Google Chrome and you click on the application link, it'll populate everything that you have previously entered. However, if you use your laptop at home, but you click on a different browser, Firefox, for example, and click on the link, it'll be blank. So it is a little bit confusing, but just know that if you do happen to lose, fear that you lost some work, try to go back to your application on the same browser and the same device, and it should be there. But again, to avoid any of those problems, that's why we recommend to write your responses in a Word document and copy and paste them over. In terms of answering the 3 detailed narrative questions, we recommend that you include detailed, thorough, and thoughtful responses following the word limit guidelines. So when it says recommended word length is 500 words, that's our recommendation for how many words we think that it would require to answer all the different components of the question in a detailed and thorough way. So do try to follow those guidelines. Applications that tend to score lower with the review rubric are applications that have really brief responses to some of the questions. And then once you submit your application through the Qualtrics application process, you should receive an email that says, this email is confirming that thank you for submitting your application, it's been received. But if you do not receive that confirmation email, I recommend emailing Krista Bobick and just making sure that we did receive your application. So I just want to say that again. Once you submit your application, you should get a confirmation email. If you don't, reach out to Krista and make sure that we have it. And this is another reason to submit it early, just in case there are any process or problems with the submission process. The timeline, so once we receive all the applications on February 9th, I immediately go into the system and download them all. And then we have a review committee that consists of program staff, Shelley and myself, and a community reviewer. And we review all the applications according to a rubric, and the rubric follows directly from the questions. So there's nothing in the rubric that is like a hidden priority or anything that we're scoring that we didn't ask about. If you answer each question thoroughly and thoughtfully, that's what we're looking for on the rubric. We will let everyone know of our decisions by February 28th, so by the end of February. And we intentionally want you to make these decisions early. It seems kind of early for a field placement that starts in a program that starts in the fall. But we have this timeline so that you know when you're going to start looking for a field placement, you know whether or not you're in the IBHC program and whether or not you need to look for a specific qualifying site. Shelley will call everyone together and have a field orientation meeting in early March to review all the details again about qualifying sites and to help you begin that process. And then in the fall, sometime around the very beginning of the semester, we have an orientation kickoff meeting where we invite all IBHC scholars and all of your fieldwork instructors. And we, again, review the program, timelines, training opportunities, and it's a chance to network with each other and meet your fieldwork instructors. So if you need some encouragement for why you should apply to this training program is an awesome opportunity to receive specialized training in a growing and important practice area. If you have an interest in working with medically underserved communities, there's a $10,000 stipend. Who doesn't need that? What graduate student doesn't need that? And then there are these extra supports that we've developed for licensure exam prep, post-graduation employment placement in high need, high demand settings, and then connecting to HRSA sponsored loan repayment programs. And this is one area that we've really built up in our second year of the program. We've identified Alicia Powers, who has expertise in all of these areas and is really looking forward to supporting students with these additional supports. So what we've done here is pull some of the frequently asked questions that we've received. And then, so I'm just going to share some of these with you and responses, and then we'll open it up for your questions. I'm in a cohort program. Will I have to switch field seminar sections? And the answer is yes. If you're in a hybrid program, you've been with your hybrid cohort for all of your field seminars, and you will have to switch to the IBHC field seminar if you're in this program. And oftentimes there's a lot of hybrid students in that seminar, so you might know folks. And we do offer a hybrid option for the field seminar. And sometimes we offer 2 sections of hybrid and 1 section of a weekday or a weeknight evening. It just depends on what the situations are of the scholars in the program. But those seminars are just IBHC scholars. Are hybrid students eligible? Yes, absolutely. Are area of emphasis students eligible? So Julie mentioned area of emphasis in immigrants and refugees. We also have an area of emphasis in aging, and AE students are absolutely eligible to participate in the IBHC program. Are part-time students eligible? Yes, absolutely. In the year that you're planning to complete your clinical field placement. So if that's you next year and that's your plan, you would apply now. If you're looking at doing that clinical field placement in a future year, you just apply the winter before you plan to complete that field placement. So if you're not going to be in a clinical field placement next year, you just wait until next winter or whenever to apply to this program. Are DACA students eligible? Unfortunately, no. And this isn't something that we agree with, but we have to go with the federal guidelines of eligibility. Will this stipend affect other funding that you're receiving? I'll say that if you have very specific questions about maybe you're receiving VA funding or other types of funding and you want to know how this would impact that, if you send me an email with your student ID number, I can connect you to Graduate Financial Aid, who will give you a very specific answer given your situation. And I will say that we've inquired on behalf of a few different students, and it's never impacted other funding that they have received. So, but we can check again on your situation. The only program that you cannot do at the same time as IBHC is our OSEP program, the Office of Special Education. I forget what the P stands for. But we do, that is another program that MSW students are eligible for. It's also $10,000. I think that's a scholarship. And that is the only program that you cannot do concurrently with IBHC. You can do them in separate years, but not the same year. So Shelley mentioned the required elective, Graduate Social Work 629, the integrated healthcare course. If you've already taken it and you took it either this, if you've taken it last year or until now, it does count for this training program, so you don't have to retake it. But if you took it prior to last year, we have enhanced that course. And so we have created some modules that are non-credit bearing, no cost to you, that contain the enhancements that we've made to that course. We would ask you to complete those. If you've already taken all of your electives, can you still apply? You can. And again, we created those modules that are non-credit bearing and no cost. We would ask you to complete them. Then I'll also mention that 629 is offered in the summer and it's offered in the fall. This summer is a social work class. I think it's hybrid format. I'm not sure about the format, but that would count, or the fall would count. And some of your schedules dictate when you get to take electives, whether it's the summer or the fall. But if your schedule allows you to choose, we would highly recommend you to take it in the fall, because that class is the one where it is co-taught by a nursing faculty and a social work faculty. And there are nursing students who are taking a nursing class called Whole Person Health, and social work students who are learning in the same material at the same time and having interdisciplinary dialogue. So if you have a choice, that's what we would recommend, but they both count. Okay, so thank you for all of your attention, and we are happy to answer any questions that you have.